Welcome. Hi, I'm Sara Kooperman, and I'm the CEO of SCW Fitness Education. And I have these amazing men that are involved in and on the Standards and Highlights Committee for IHRSA. And we are going to be talking about Active and Safe Initiative. Now, what I'd like you to do, if you would be so kind as to please move your mouse, go to the bottom of the screen. You're going to see the green share button. Please go to the left of that. You're going to click on the chat box and please type in your name. Tell us where you're from. We love to know where people are coming in from. I see Dawn and Doug and Ellen and Jackie and Liz, and thank you all for joining us. Hi, Jackie. See you there. So please tell us where you're from. And what I would like to also know is any questions that you have throughout this webinar. If there's something comes to mind, please type it in, ask us, we want to know. So today we're going to talk about IHRSA that has launched the Active and Safe Commitment. It's an initiative to reaffirm the health club industry's unyielding dedication to safety at this time when exercise, I'm out of breath, right? When exercise has never been more important to global health. So I'm really excited. We have Brent Darden with us. He is the interim president and CEO of IHRSA. He's very generously taken on that title, and he is also the chairman of several Rex roundtables. So welcome, Brent. We also have Bill McBride, who has been on webinars and presented at Livestream Mania. Thank you, Brent, for joining us. He's the co-founder, CEO, and president of Active Wellness, and he has a wonderful consulting firm, BMC3. Okay, and then we have my new friend, I can't pronounce his last name, Frank Ancharski. He's an industry veteran and serving as GM, General Manager, Vice President, CEO, and owner. And he's the founder and chief coaching officer of his boutique consulting company, Club Coach Services. And before we turned the webinar on, I asked him, like Frank, why in the world were you on the Standards and Highlights Committee? Besides, he's got a good sense of humor and he's very friendly. But he coaches so many facilities, which I think is a wonderful thing, because you think, okay, our club's open. And I think now is the time we really need to look at stuff. So I'm going to start with Brent Darden. And what exactly is the Active and Safe Initiative?
Well, before I get into what the Active and Safe is, Sarah, I just want to thank you as well. You're serving on that Standards Committee, the headlight team, as we call them at IHRSA, as are Frank and Bill, and you guys have done a great job. And the industry really appreciates y'all volunteering and making things like Active and Safe happen. So that's the first thing. I wanted to make sure that I covered that. You know, the impetus for Active and Safe really was the need that we've seen through the pandemic, which is we've gotten a lot of feedback about our industry that we really don't like from elected officials and perception of the public. If everybody can remember early on, and not too distant ago, we were lumped in with bars and casinos and entertainment and really viewed as unsafe. I hate to throw out the word, but I'll use dirty, right? Some of the politicians that are making the decisions may not have been in health clubs ever or in years, and their view of who and what we were all about was really skewed. So at its origin, really, the Active and Safe Commitment is about a way for clubs to join together and demonstrate their commitment to providing a safe environment and relatively low risk environment for people related to catching COVID-19.
Yes, that was very succinct and very clear. Bill, and you're on the Highlights and Standard Committee, and what drove you to support this?
Well, I just believe our industry needs to up its game and credibility and standards. When Brent and I were on the IHRSA board together, I served on the Standards Committee, you know, a lot of people have put a lot of time and passion into standards around our industry. And Frank and I are on, you know, a broader group with standards. There's a whole nother group that works specifically on Active and Safe that did a great job that we were kind of involved with a little bit on the periphery, but we kind of broke it up into immediate and long term. So I just think that our industry needs to up its game and credibility. that, we've been preaching the same thing to the 20%, 25%, and 75% of the people out there we're not as essential to. And I think that it's a shame, because everybody I know in the industry is committed to helping other people make a positive change in their lives. And yet we don't have the respect and credibility that we think we deserve. And there's a reason why. We have fallen short in a lot of ways on this subject.
And I think that's why the government looked at us and said, you're not essential. Like, they would rather play Medicare, Medicaid, the insurance companies going bankrupt, with all the obesity, inactivity, the overweight, all the health problems that are becoming compounded by the pandemic. And yet we keep talking about exercise is medicine, medicine, but they don't hear us. And that's why I think active and safe is, yes, we're clean. Yeah, we're going to spray down machines. We're going to put plastic up. We're going to make sure we have distancing and masks on. But we're an essential business, because we're the only thing that's going to keep, I'm getting a little dramatic here, but then, hey, that's my role. But we're the only thing that's going to keep these people out of the hospital. And I'm not talking about COVID. I'm talking about having enough of health and immunity. And it's not like, oh my gosh, I have to do a HIIT program 3 times a week. It's like, I just have to walk. I just have to stretch. I just have to stay healthy. And we're the leaders in the industry. And I got to say, why aren't they looking at us like we're essential? Frank, what do you think about that?
Well, I think, to Bill's point, I don't know if we've really earned it from the public yet. We all know about the benefits of exercise, but I don't think we've actually earned their trust yet. And I think this will help unify us, almost like a good seal of good housekeeping seal, so that there's an opportunity for us to actually expand our standards. And that's what the committee is going to do. And there's a long-term project ahead of us, so that we can earn the trust. We can't just say the exercise is medicine and the benefits of exercise are the way to go. We all know that. The public doesn't, and neither do the politicians. And so I think we have our work cut out for us. But the way that Brent has identified key committees, like the one we're all on, to be able to really eat the elephant one bite at a time, is a smart way to go. And you've got people who are so committed to wanting to create that good seal, a good housekeeping seal for us as an industry.
Yes, yeah. I just add a couple of things onto that. Thank you for those comments, Frank. But, there's been so much research done about the risk of COVID transmission in clubs, around the world, from Europe Active to Fitness Industry Canada to something in Portugal to broad-based studies here in the U.S. By last count, I think we were over comparing 40 million plus health club visits to the risk of contracting COVID. And the risk was 0.002%. Just really insanely low risk of contracting COVID. And now we've looked at what some of the states, like the state of Colorado and some others, have done their own contact tracing. And if you look at their own health department's website, it'll let you know where contact tracing is leading people as far as where the transmissions are occurring. And in the state of Colorado, even though they've been open for now going on, probably 4 months, 0 cases traced back to COVID. There's one case in the whole category, which is called recreation, and that was a cheerleading camp where the COVID was transmitted, but none in clubs. So it really is just undeniable that clubs are relatively risk-free. And this whole concept of active and safe was really built on and copying to a degree what happened in the retail restaurant industry, where restaurants had safe serve to sort of demonstrate their ability to maintain a safe environment. And then the hospitality, the lodging industry had stay safe, as far as something that they could communicate to their consumer about how hotels are safe and you should feel good about staying there. So the active and safe is really our industry's statement to the world, the public, elected officials, that, hey, we're doing what we need to do. Come on and join us. Nothing's 100% safe, but compared to a lot of other things, this is extremely safe.
So that kind of leads us right into the, our next topic, which would be, how will this help the club owner and the fitness professional in the long run? Brent?
Yeah, well, it's going to help the club owner because we need this, Frank used the right word, which I think is seal of approval. If you go to a hotel, which I've done a few times throughout the pandemic, you go to open your door and there's sometimes this tape across it and it says safe stay. And then you go to pick up the phone and it's got a sticker on it, or the remote control or high touch areas. So they're getting that message out to the consumer in their mind that they've taken steps to make sure it's sanitary and safe. And so we need to do that same thing in health clubs so that the people that are visiting our clubs, our members and guests and people from the community, can see visually that we've taken the right steps. And by joining in this effort and getting this information out, it really unifies the whole industry around a common element of this safe effort that we're putting out there.
And Mike Lieber, who's helping to run this webinar tonight, actually put the link in to the application. SCW did the application. It's fast, it's easy, but all the guidelines are laid out. And I think those guidelines, they're very clear. They're not overly comprehensive. Frank, you're nodding, but they're not overly comprehensive. They're easy for people to follow. There's downloadable materials that they can use. So there's no cost, right? There's no cost.
And it's available for members and non-members too, right?
Right.
Brent?
Right.
Right, members of IHRSA and non-members of IHRSA. It's all about us showing solidarity and showing the quality. And Frank, you're obviously on the highlights committee. What are some of the points that we've seen in this active and safe protocols that you think are the most important, or that stand out, I should say?
Well, I love how this was worded, and I'll pull it off of the website. It's an unyielding commitment. And I think, to me, that's one of the most important words about this active and safe, is this unyielding commitment. And I honestly would challenge the audience to say, if you aren't willing to get on board with active and safe, you really have to ask yourself the question, why not? What could be a compelling reason not to want to have this sort of seal of approval that the general population is having a hard time feeling safe? So I would tell you this commitment, if you're on this call, and spread the word, is to be unyielding about it. And that as we go through our standards committee, there's going to be continual standards set aside for the industry. And I'm really excited about the possibility. I know Bill's a big fan of this, is potentially licensure and certification for these clubs. That's a big ask, but it's something that's on the radar, and we're hoping we could maybe go that way. I mean, I think that's what we need. We have to take a step up, and Brent mentioned about the Restaurant Association. The FDA has a food code that you all are familiar with when you go to restaurants, A, B, and C. And as I understand, the rating is a C rating, is you still could be open and it's still safe to eat there. But are you really going to go in a place that says C? So who knows, maybe that's the second generation of this active and safe as a possibility.
And the governments have gotten involved with regulating so many different businesses. And it's very expensive to regulate an industry. It's very expensive to license, because they have to set up committees to evaluate it, and they have to set up protocols to follow, and they have to hire individuals to go out and review facilities as well. So it's expensive. So we've got to prove that we need this. And that's where this active and safe, again, it's so simple to do this application, that this is a first step in an initiative. And it's not like this is America and we want to be controlled. Canada does this, Australia does this, it's all over Europe, where there's a lot more control, and therefore a lot more of the industry as a whole is viewed far more professionally. Bill, what do you see that's going on behind the scenes to help the fitness pros impacted by this last year, this entire, it's last year, we're almost there.
Yeah, I mean, back to the other point, there's all kinds of ways to, approach it. You can have permits, you could have a safety permit, just like you have a massage permit. You don't have to go full licensure. You could have a licensed facility, you could have a permit that just shows you're safe. You could have a third party regulation. You could have what we're trying to do now is self-govern, right? That's what we've always tried to do. That's the least level of governmental credibility, but it can still help shift perception of an industry, right? Everybody agrees fitness is essential. No one thinks health clubs are essential. And there's a perception and there's a reality to what we do. So, we talked about optics. We talked about commitments. We talked about, it starts from inside. Doing the right thing by your own people, by your own staff and your own members, sharing that with your community, and being involved as a voice. And Brent's got a lot of experience with the state alliances and with IHRSA, what they're doing with public policy. But we've got to have a commitment to a higher level of care, and we've got to be connected to the broader audience. And our industry is small as it is, and then within our industry, we tend to fragment ourselves into for-profit, nonprofit, studio, this, that, and the other. We've got to all work together, and IHRSA's created a platform where everybody can sign on to this thing. We only have 1,200 organizations right now signed up. Now that 1,200 represents a lot more sites, but it's still a dismal number compared to the universe that we're talking about. And what we're doing here is we're calling on everybody in the industry, every employee, every manager, every owner, to speak up and say, hey, we need to make this commitment. We need to up our reputation. We need to up the credibility of our industry. And, cliche is old, but, a rising tide lifts all boats, and we've got to do what we can to cause that tide to rise.
Yeah, because it's important. I think, in America, and especially we've seen so much going on lately politically, there's a lot of self-governance. Okay, and self-regulation. As an industry, we self-regulate. And also, okay, here I go again, speaking out of turn a little bit.
Go ahead, do it.
I know, go for it. But being a free market economy, we're a free market economy. If I'm running a certification that's high quality, somebody's going to tell somebody else, and I'm not only, the next time I'm not going to get 2 people attending a certification, I'm going to get 4 people. So I will succeed as a business if I'm good as a business. But if we want to take the fitness industry, I see us as the next step right after a physical therapist, right after a doctor's visit. They dump these people on us at health clubs and say, you need to exercise, get on a treadmill. I'm like, terrific. They're going to, we've got to make sure that we've got safe protocols in place to handle I think what's going to happen after the pandemic, and even obviously beyond that. But if we do want to be looked at as an essential business, and we do want, and I'm getting into a little bit deeper here with the FIT Act, making sure that we can have a credit card or a credit card that we can use that uses pre-tax dollars to pay for my health club visit, my health club membership, my boutique studio membership, maybe my YMCA membership, that I can go in and use pre-tax dollars. That is a big savings for me. If I'm paying 40% of all the money I take in goes to the government, and I'm using whatever's left over, that's 60%, and I gotta use that to pay for my health club membership, that's expensive. But if I can use pre-tax dollars, that's like getting a 40% discount on my membership at a facility. And these are essential businesses. And to prove to the government that we're an essential business, this active and safe commitment, it's so simple to do, is you go in, you fill out your name and your address, you attest that you're going to adhere to these simple and safe guidelines. It's easy to read. I know Mike put the link in the chat box, but it's important for us to do because we weren't seen as an essential business. And I'm going to ask you, Brent, I'm going to dig a little deeper here, but I look at these state alliances and it didn't work, okay? And I'm wondering, why can't the state alliances pool their funds together and hire a really high-powered lobbyist that can really try to push us through a little bit more as an essential business?
Yeah, well, there are, as of today, 16 state alliances only. Of course, you know, that's not one in every state by a long stretch of the imagination. And there are a few that have had some success, but it has been mitigated to an extent. They fall under this new entity that we've created, IHRSA, that we've just launched as of January, just this last week, called the National Health and Fitness Alliance. And that really is sort of the advocacy, the lobbying arm, the one that the lobbyists are paid out of. Our public affairs, our national messaging is going to be coming out of that. So that's one way that individuals could get involved, is they could support the National Health and Fitness Alliance. It doesn't require membership. If you have some wherewithal to contribute financially to that, that's exactly what that entity is made to do, is represent us all across our entire industry with the federal government, so that when we look up, you know, it's really, to be honest, unfortunately too late for the pandemic. You know, I mean, we're making ground now. And I will say the tide has turned, whether it's Governor Como or others. You know, if you've seen the videos we've been putting out, they're saying, they admit now health clubs are not the problem. So they've changed that language, which is good. We still need the relief, and we're still not where we want to be as far as considered essential. And that's a long-term game. So we need people not only to join the NHFA, but also to join IHRSA. And I want to make sure, especially for a lot of people listening that may be health and fitness professionals that maybe don't own a health club, that's fine. We're all in this together at different levels. One of the greatest things that IHRSA is doing, one of these other committees that we put together, is we're establishing a membership at IHRSA for studios specifically, which we've not had before. We're also establishing a membership just for individuals. And if you join IHRSA as an individual, then fully half of whatever you're paying for that membership is going directly to advocacy to help push forward the FIT Act, which you're talking about, the relief bill, which is relief financially for how businesses have been hurt through the pandemic right now and into the future. So there's a couple of ways that people could get involved.
And if I may, Sarah, can I add to that? Because
Yes.
I'm on that committee that Brent assigned me to for the membership. And I want to just say is that not only is it going to be for individuals, it's going to be more affordable. And it's for those people who, A, might have been laid off and they don't know where to search for things and not have the access from their club, or if in fact their owner has chosen not to join IHRSA, which can happen, they can still join on their own. So it's really exciting to be a part of a movement like that, to really get after some of the grassroots members that could help grow IHRSA.
Is that open right now?
Not yet, it's not official.
Not official, but the National Health and Fitness Alliance, that is open right now.
Yes.
And I'm going to ask Mike Lieber. He did. He already put it in already.
He's
He's frightening.
That's great.
Hey, one other thing, to Brent's point, with only 16 states having alliances, this industry still has a lot of room to grow. 50% of health club members, if I remember this stat from IHRSA correctly, are represented in 10 states. So the top 10 states in density have 50% of all the members. The other 50% is in the other 40 states. So we still have a lot of work to do in a lot of states with regard to increased penetration. I mean, you've got states that are in the low teens versus our national average of 20% or whatever it is right now in penetration of population. So we really have a lot of work to do in our industry to tell this story.
Yeah, to that point, Sarah, sorry, a couple of things I just can't resist saying. Number one, to Bill's point, one of the reasons our industry at large finds ourselves in this predicament of not being essential and not feeling the love, if you will, from elected officials is because only 20% of the population, 22% of Americans belong to any kind of health club or gym. which means we've got, almost 80% of the population that doesn't. And as I've been, pretty straightforward with people, I'm like, 80% of the people could care less whether clubs are open or not. Really. They'd much rather the bar be open, or they'd much rather the casino be open, or the restaurant, or the mall. And if we really want to change the long-term outlook, we've got to become more of the sort of the healthcare continuum and the solution, all the things that we talk about. But it really goes back to reaching that audience that we haven't been so successful with for decades. And part of our success is really going to be adding more people to the choir. So as Frank was alluding, we need the health and fitness professionals. We need the independent people to join the choir, even if it's a very low membership level, just so that our choir and our voice can be bigger and louder.
No, I think that that's very important. It's very exciting to hear that there's going to be that there's going to be different levels of membership, because I do think the numbers will, even if the cost is lower for an individual, the numbers of individuals that will want to get involved will cover that cost. And I think we really need to have this National Health and Fitness Alliance focus on high quality, affordable fitness programs, but it's got to be that high quality, or else, again, we're never going to get that label of essential.
Sarah, can I say something to that?
Please.
And this isn't about doing the 4 major points of the pledge, the Active and Safe Pledge. This is much bigger. This is not a marketing play. This is not, a campaign. You got to really walk the talk and be authentic in this. And this is a shout out to operators with group fitness and to group fitness instructors. If you want to find out how you're doing compared to some others in your market, talk to your group fitness people, your group fitness instructors and trainers, because a lot of them teach at other places, and they'll come in and they'll tell you, man, they're doing this so good at this club with regard to protecting us. You guys aren't so good, or you guys are doing so much better than they're doing. You can't fake this. You can't fake excellence. So, and if you want to get a benchmark and you're not using, MXM and voice of the customer, experience management, talk to your group fitness people, your instructors, and they will tell you what's going on in your marketplace with regard to how you're doing compared to the others.
Bill, what's the number one thing that your clients are asking you for now?
My clients being the members in my facilities.
Let's divide this into 2 areas: the clients in your facilities, but also I know you got the consulting services. I'm going to ask the same question to Frank, but what do you see as that clubs are asking you to assist them with?
Right now, people are still in, hunker down, expense management. What do I do coming out of this? The big horizon that I'm seeing is the customer has changed in how they look at things, and your sales and marketing approach has to evolve quickly. You have to treat the customer with the intellect and education that they come to the table with, and you can't shine them. You can't BS them. You've got to be authentic, transparent, and direct. And so from a operator standpoint, they're looking at, okay, how do I get customers back? How do I build the confidence? How do I deal with this new reality? From a member standpoint, they want me to take the responsibility of keeping people apart and keeping people in their masks and keeping them out of conflict with trying to protect them. They want to know that I'm doing my part to help them be safe. And so, one of the biggest learnings is we've always known how social our product is, but people put the social elements of our product above everything else right now. I mean, they really need to get back to that social aspect.
Yeah, and we are going to get back. I truly believe that if we compare what we're going through now to 1919 with the Spanish flu, and then we had the Roaring 20s with all the events and all the parties and all the activity. What is it? There's 3 places people go, to meet people. It's the bars, it's church, and it's the health clubs. I kind of wish. Yeah, you notice the order I led them in. But, but that we are going to be active and we will be pulling people back. Now, I'm getting a little off track here, but how are you encouraging clubs to, Frank, I'm going to ask you, how are you encouraging clubs to approach sales right now to get members to join? How are you telling the clubs, all right, this is how you gain confidence with either a prospect or a returning client, and this is how you get them to sign up for a monthly membership or a yearly membership? What are your thoughts on that?
Well, I would say that, one of the things that's most important that a lot of clubs are starting to grasp, and that's the technology sale. In fact, I'll be talking about that on Thursday on my own webinar, but the use of technology is so important because you've got to balance what's going to be in technology with still those personal touches. And there's still that fine balance because we know people are going to come back, and the socialization is inherent in our need, in our DNA. And I know Bill talks a lot about that. And I really believe that that's going to happen. But short of that, I would tell you that what I experienced at American Family Fitness in the reopening is the simple word of invitation. What sometimes I think we forget to do is invite our existing members to come in who are fearful of coming back. And I can't tell you how many sort of new sales who were on freeze started to join because we just invited them back. They don't have to exercise. They don't have to start their membership. And the power of an invitation and realizing how safe we really are. And without fail, I heard from hundreds of people that said that we were more safer than any other business in the neighborhood. So the clubs that follow that active and safe, which is almost all those things that are in there, will provide that. So just invite people back. Yes, they're fearful, but you show them that you have the mask. And I want to add one other thing that I think happens in clubs. And then if you want me to talk about consulting, I will tell you that the staff can sometimes get a little bit lazy about how they're handling themselves in meetings and walking around the club. A lot of times you go behind the closed doors where maybe some of the offices are, and people are getting a little too lax, in my opinion, about how they are behaving around each other and leaving that mask on and making sure you're wiping down. And even when you're working out in the facility, members really don't care how much you say you're going to do. They watch what you're doing. So I would add those two pieces.
And how are you doing these invitations? Are you doing them through social media? Are you emailing? Are you texting? Is the staff making phone calls? How are you doing that?
Good question. Email blast, the use of our app, the website, and now there's a new feature starting with chats and being able to communicate with people. And what we found is that since people have been laid off and we're shorter staffed, if we're not going to be available or our clubs are closed at a certain time, why not have somebody that could answer a question right there on the fly when it's actually a bot? And that world has changed. And I'll just tell you real quick, I was able to find my registration on a state website for my property tax in North Carolina and got my registration sticker from 10 o'clock at night on Sunday with a chat and was able to pay in a safe environment. That world is here, and we have to be a little quicker to the take on the technology side.
I do have to say that SCW, we just put a Tidio chat. It's a chat.
Yeah.
That on like every single page, on every single of all our various websites. And we have 2 people monitoring it, and they just can answer all these buttons. We do it with every conference, and we can collect first name, last name, email address, cell phone. You can collect that information through your chat. And it doesn't have to be that automated, annoying, okay, if I ask this question, if I ask about registration, I can go to the right, or I can do, you get those like little trees of answers. And I just want to strangle someone by the time I get through the tree, right? I'll just hang myself from the tree. But we have live people answering it. And it's been so effective. It's more effective than the phone. People don't want to call.
They don't want to pick up.
Able to text. They want to be able to do Tidio, and they want to be able to connect with us, because that gives them, I also think that's a level of safety.
Yeah.
That I don't have to actually go in. I want to find out about this facility. I'm going to check in and find out before I go in. And that's what Bill, what are some of the things you guys are doing to make people feel safe and comfortable walking in the facility?
Yeah, I mean, a lot of it we've talked about in some of our Sara previous webinars, as well as, Brent and I, on our show. Letting them know what to expect before they get there, using video for that, using other members to convey that message. Oh, I'm so glad I'm back. I feel great. This is much better than I thought it would be, blah, blah, blah. Then the signage, then the staff modeling the behaviors. And you're right. We tend to, familiarity breeds contempt, and we think that our friends are clean and the strangers are dirty. And if I know you and you're my friend, you must be safe. And we have this built-in human nature around that. And that's why one of the top places that people get COVID is now in their homes, right? Because they've brought people back in that they're close to. And so, we can't let our guard down when we're talking about safety. And so staff modeling those behaviors.
And one of the things I enjoyed about what was going on with the committees, and Brent, maybe you can highlight this, because as you said before we turned the camera on, there's several people behind the curtain who really, Killian from, where is he from? He's got a beautiful accent. Ireland. I'm going to say Scotland, Ireland, right?
Mm-hmm.
I don't know. The country's as big as Iowa, so I don't know. It's
Ireland.
Yeah. Okay. Sorry. It's showing my Midwestern charm. But where did IHRSA decide to pick the elements for active and safe? And it didn't just, it came out from a lot of people with a lot of great experience, posters they can use, stickers they can post, press releases that are applicable on a large scale that also can be used in a small scale in an email, things like that. It's a very simple thing. I feel like I'm on QVC. There we go. It's like, just go look at the website, fill it out. You get a Dropbox of all this information. Brent, how was that figured out? All the things that would be supplied to the active and safe participants?
Well, it's a headlight team, and it volunteers like all of the three of you that volunteer time and expertise. And they reviewed, again, examples that already existed in the hospitality industry, in the retail industry, the airline industry, the restaurant industry. So, we had a few examples to go from. We wanted to keep it simple, straightforward, achievable. And to your point, the templates are there for you to take and do with them what you will. One of the more creative things that clubs have done, aside from the press releases, is they're putting that active and safe on all employees' email signatures under the logo of the club. And so every time they're communicating with their members, they're communicating and reinforcing this active and safe message. And Mark Merritt, who owns the Merritt Clubs up in Baltimore, multiple high-end luxury clubs, has been doing that for months now since he started. And he talks about he gets so much positive feedback about their commitment to maintaining a safe environment, in part because they're promoting it so consistently in these email messages. So that's one way to use it. And I want to jump back to one thing you were talking about, and you asked Frank and Bill, and I didn't get a chance to weigh in on it about.
It's because I didn't want to hear from you, Brian.
Yeah, and it's not even my answer, but it's about what members are wanting from their clubs. And Blair McHaney is a good friend of all of ours. He's the CEO of MXM, which is the member survey component. And I was in a meeting with him earlier today. We were talking about this very thing. And he said the number one thing is they want clubs to manage the members. So whatever your restrictions are, whatever your policies are, if it's mask 100% of the time, they want the club operator to make sure members are wearing masks 100% of the time. And if they're supposed to wipe down equipment, they want to make sure members are wiping down equipment. And if you're supposed to stay socially distant, then they want to make sure the staff is keeping them socially distant. So I just thought I'd throw that in because there's some, real data that MXM collects, and that tends to be the number one response is, what do you want from health clubs? We want you to help manage the members.
And that's one of the hardest things.
Yes.
I mean, they walk in, and the other day I walk in, and the woman cleaning the locker room has her mask under her nose. And I was like, hey, Lulu, pull it up, baby, and she just laughed. But we all have to work together, and that's the most difficult part, because these people, the members think they own the world, and it's very difficult to respectfully have these protocols. Yeah, Bill?
Remember a time when our biggest issue was members upset at other members for talking on their cell phone?
Yeah.
I remember the worst thing is as a group fitness instructor, what happened? Somebody took my spot. It's like, oh my God, let me kill you now, right? Yep. But Brent, I want to reiterate what you said about putting the active and safe logo in your signature of your emails, okay? Having it posted obviously in the windows, having it posted in the locker rooms, if your locker rooms are open, having it posted in the front door. And then the posters are very simple, talking about masks, talking about social distancing. And it's not just, one of the things that I always think about is, okay, I want to adhere to the law. I'm a lawyer, right? I want to adhere to the law. Well, my club is open, but group exercise isn't open in Illinois. All right. And I know that there's some facilities that are like, well, once you get on the treadmill, then you can take your mask off. Well, you know what? You shouldn't do that. You should keep your mask on. And these are, do you err on safety? Do you adhere to these 3,400 some different county regulations? So this is, again, a way for the health club industry, for the fitness industry to unify and try to elevate our status to an essential business, an important business, and make sure that there's quality control.
What's interesting, Sarah, about that, about breathing heavy, during exercise, there's been a lot of debate about that. There's several engineers at MIT that have done a research study on that very thing. The number one risk related to sort of respiratory transmission is singing, by far. Yeah. Is almost 50 times worse than talking or breathing heavy on a piece of equipment. Singing is at the very most risk. Talking loudly is next. And then heavy breathing, like when you're exercising, is third on the list. Isn't that interesting?
So there you go. So churches shouldn't be number one, bars shouldn't be number two, and fitness clubs shouldn't be number three. We're going to reverse that order.
When the guidance came out for Thanksgiving, they discouraged singing, chanting, and yelling or screaming.
That's because we all do chanting at Thanksgiving. Is that why?
I thought we just do yelling. Isn't this a family gathering? Yeah. Well, we're almost at the end, so I'm going to show you guys a really short video. IHRSA has working with Rex Roundtable and also SCW, and Bill, the active. Hello, here I go again. Active Wellness, and we've got MXN, and everybody's getting together and putting together, trying to do a really fun, once a month, kind of intense webinar that's going to address some current topics. So I'm going to show you a quick video on that, and then we're going to come back and hear closing statements, closing arguments from Frank and Brent and Bill. So here we go. I'm going to share this with you guys. So this is kind of exciting. It's going to be on Wednesdays, and it's going to be at 1 o'clock. And Brent, do you know, is it going to be the third Wednesday of the month?
Yes, we talked about it being the third Wednesday of the month. So this first one's going to be obviously on the last week of the month because it's our kickoff session. Then we're going to move to the third Wednesday of each month. So people can look forward to that.
Okay, perfect. And Brent, let's just start with you. In closing, we've launched the Active and Safe Commitment. What's your message to the people on the webinar?
Go to the website at IHRSA.org and sign up for Active and Safe. And secondly, look forward to the end of March, and I'd really encourage you to join IHRSA. It's a very low membership fee, and if you want to help support the industry into the future and make sure that we're not slotted as non-essential again, this is your way to do it.
Okay, excellent. SCW is fully supportive of that. And Frank?
Yeah, I want to do a quick shout out to the people who are on the Standards Committee. Of course, this group that's already on it, but John Nasta, Bob Stedman, Aaron Moore, Brad Wilkins, Luke Carlson, and Killian Fisher. Those guys and all of you have worked really hard to move forward. So shout out to them. And I feel compelled to speak to the individual for some reason tonight. And I want to share a small quote that I got from the Dalai Lama. And that is, because you can make a difference, no matter if you're a club consultant, an interim CEO, an owner of a major firm and consulting company. But if you think you are too small to make a difference, try sleeping with a mosquito and see how long you're going to sleep. Everyone can make a difference. And to Brent's point, we need you. Be active and safe. Thank
you. Thank you. Bill?
Yeah, I don't know if I can go after the Dalai Lama. Just don't underestimate the consumer and don't underestimate your team. And if you want happy customers, you got to have happy team members. So focus internally and then expand externally.
All right, excellent. And my message, we're still in this together. It's gotten very frustrating. I know this has been going on 10 months. We're just about to enter our 11th month of this pandemic. And we started out so beautifully because we thought this would all be over and we're all in this together. And then it's just, a lot of it's gotten shattered, maybe the influence of politics going on, social unrest, but we're still in this together. And I agree, you can make a difference. Be a mosquito.
That's
okay.
Right.
And on that, I'll talk to you guys later.
All right,
Thank you, Mike, for running the webinar.
Bill,
Thank you,
stuff,
guys.
Buddy. Thanks, gang.
Thank you for joining.
Thank you all for joining us.